It was a time like no other. As soon as COVID-19 reached our shores, it took a grip and devastated so many lives. Everyone in society has been affected, but this is a disease that hurts the poor, vulnerable, and those of the Black, Asian, and ethnic minority community in particular. As the severity of the situation became clear, Unite stepped up to keep our members safe.
When I heard about pandemic at the beginning, I feel it's something that's happening far away, but it's not going to come to us.
Everybody was very fearful at that time that we were all going to go down with this terrible illness.
At the airport, there were planes coming in from China with a very infectious illness, possibly being carried in by passengers.
And as soon as COVID hit in, everything just changed just like overnight.
Many of our members felt an immediate hit. Cab drivers lost their passengers. All but essential construction work was shut down.
It was more or less a light switch being turned off. The taxi trade ultimately just shut down completely.
Effectively, after an online meeting called for the closure of non-essential construction in the Republic of Ireland. It was not an easy decision. All the membership agreed it was the right thing to do. I don't know how that would have worked if the sites didn't show. I've no doubt it saved lives. It was always health over wealth in Ireland.
I never became hardened to the stories, but they were harrowing. We had one instance, and the fella had been out working 14 hours, and I think he'd amassed £20. And I'd said, "Why are you putting yourself at risk? Why are you going out?" And he said, "Because if I don't go out for £20, we're not eating tonight." It was that bad.
Today, I can announce that for the first time in our history, the government is going to step in and help to pay people's wages. And can I put on record my thanks to the Trades Union Congress, the CBI, and other business groups for our constructive conversations.
The job retention scheme was a vital part of the response to the pandemic. Without it, we would have been looking at apocalyptic levels of unemployment. Securing that was a collective trade union effort, which really saved a lot of the country from destitution.
Pubs, bars and restaurants closed their doors. Hospitality workers were left fearing the worst.
Obviously furlough was announced and it was 80%, but nothing else went to 80%. My rent was still 100%. It was terrifying. People like myself were the ones that were struggling the most. I can't work anywhere because everywhere was shut. So I thought I was going to lose my flat, going to lose my job, and didn't know what was going to happen the next day.
Those who could work from home were forced to adapt.
Didn't really have space to set out my desk, which meant I had to work in the living room most of the time. I've got barely enough money to cover my rent, and at the same time I'm feeling like I might be losing my job. So it was definitely a dark time.
And our thriving aviation sector shut down entirely. With all planes grounded, the industry shed over 5,000 jobs a month.
It's a bit like looking at the end of the tunnel at a train coming towards you, realising that this industry may never come back to what it was like.
It was a very, very weird, very different. It was like almost eerie. You would go into your place of work and there was no one else there. You were the only one there. I've never seen an international airport so quiet. And I think it was hard for aviation because there was no answers.
As a union rep, people were coming up to me and asking me what we could do, and I didn't have all of the answers. I felt scared because it was something that I couldn't control.
But everybody knew everybody, and I'm just like, oh my goodness, that person's leaving, oh that person's taking the redundancy, oh they've lost their job, and I'm just like, oh my goodness, how many more people is this going to happen to? From something that you would have thought was such a secure job, you had that security and that safety, to then hit a national pandemic and it's all gone. And you've gone from probably a very stable lifestyle to, I've got no job.
dozens of Unite bus workers who work to keep our cities moving lost their lives.
Getting onto the buses and driving the buses around, and you're picking up the people and everything, is really scary. Especially in the Asian and the black community, they say that, we are high at risk. With the stuff like the PPE equipment and everything, I do believe the companies should have pushed their way forward on that. I think it was about after 4 weeks that when we started to get the stuff and the masks. We had 8 cleaners that went down with COVID. We got management, got the unions, and a lot of people are there to help out. I was here from 7 o'clock in the morning till 11 o'clock at night. Fueling up the buses, washing the buses to make sure they were going out. Losing 8 cleaners, not cleaning the buses, not sanitising the buses every night, that means no buses would have been going on the road. So that would have caused problems. You wouldn't have nurses going to work. We put our lives at risk. It was tough.
My father, Ranjit Chandrapala, was a bus driver, and he worked all through the pandemic, and unfortunately he contracted COVID and was very sick and passed away in May 2020. I thought that he would beat it because he was incredibly fit and healthy. The nurse there was amazing, and she was stroking his hair, and he had this beautiful white hair, and he looked a bit like Tintin, like a really boyish little curve, curl to his hair. And she was, patting that down, and it really broke my heart, really. But I was so deeply grateful that there was someone there, touching him in those last moments. He brought me up with such care and love, and not to be able to give that to him in those last moments was very, something that I will carry with me.
Social care went into crisis. The sick and the elderly were discharged from hospital, bringing the disease into ill-prepared care homes, where staff and residents were put at risk by a woeful lack of PPE.
When the pandemic hit, they wanted to create a lot of bed capacity, absolutely, because they felt that we were going to be overwhelmed. So the beds were cleared by patients who could go into care homes if they had a step down and the care didn't need the hospital care. Patients weren't tested when they were discharged to care homes, and I think taking that into the care homes, and certainly the scrabble that the care home staff had for PPE, and shifting guidelines or looking for guidelines which were afforded to NHS staff, must have been terrifying for the care home staff, I feel.
We were quite a lot initially last year in nursing homes, and we could see how inadequate their PPE were, and I would have been speaking, to different ones and saying we need to push this, we need to sort it. They were really dependent on us to take charge and to help these people. The hospitals, they needed their beds, so the nursing homes took in a lot of patients, and before they knew it, they were overrun with COVID. So we were arriving, sometimes not the first ambulance or even the second ambulance.
I know in the early part of the pandemic, people were not given adequate PPE. There were people who were working in care homes who were just given the disposable bibs and things without having proper masks. And we did have a disproportionate number of people die who were in the care homes. And I put that right down to PPE.
And people who worked in care homes actually not going back to their own home. They were living in the care homes because it was a way of trying to prevent any infection going back to their own homes. People were living in camper vans in the car park. Key workers out there really putting themselves at risk and putting their lives at risk to care for others.
On some of the wards, we did have shortages at times of masks. We didn't know how many. There's a lot of guys asking a lot of questions, and we didn't have any answers for. It's all over the news that nobody's got any PPE. We have got PPE. We don't know how long it's going to last. Is it the correct PPE? Little unsure. A lot of these guys had to go in an awful lot into these wards, especially when they had all new oxygen lines going in. They have to have the full PPE, but still very worrying, especially when you can see people struggling with life.
The country's death toll mounted. Remember how shocked we were by 5,000 deaths? Who could have foreseen the full horror of 160,000 by September 2021? And yet a national inquiry into why the UK took such an enormous financial and human hit is still some way off. As the scale and urgency of the crisis dawned on Unite, We wasted no time in doing all we could to face the situation head on and to protect our members, getting proper PPE to the front line, securing furlough support to keep a wage coming in, getting health and safety checks and guidance into the workplace.
Just shortly after the first lockdown had happened, I was approached to ask to help coordinate a local initiative to make scrubs for the NHS because they didn't have enough. And I spoke to my regional secretary, Jackie Pollock, and he actually gave me permission then to do it within my work role.
Look at all these gorgeous scrubs. Guys, I know how much effort it goes into making each and every one of these.
There was over 6,000 volunteers, and that would have been drivers, cutters, sewers. Our youngest sewer was 11, our eldest was 97. They were throughout the length and breadth of Northern Ireland. We were actually producing the scrubs quicker than the NHS could buy them in from their suppliers. We produced in that period of 9 weeks 107,000 sets of scrubs. But it was only doable because of the reach that Unite has. And I think what was a really fantastic consequence of what we did was that Unite then became a household name. Everybody knew that Unite was involved in this. Everybody knew that Unite allowed me to project manage what I had to do. Unite opened doors. Unite was able to get funding. Unite was able to make things very quickly. But one of the overriding things I'll never ever forget about the whole NI Scrubs initiative was the purpose and joy that it gave to so many people at a very, very, very scary time.
Thank you, Scrubs!
We also fought those unscrupulous bosses who sought to profit from the crisis, adopting the abhorrent practice of firing then rehiring.
Unite Union has tried to put a stop to fire and rehire policy. British Airways started this policy early on. About 10,000 people were made redundant. The union has played a quite vital role to stop these employers to misuse the situation.
We fought with British Airways, Go Northwest, JD Egbert's Coffee, Good Lord and Weetabix, and we are now working to change the law to stop this appalling practice.
Firing them and then rehiring them, it's just absolutely terrible. And I even now, I really don't understand how they're thinking that the current people would be happy with this. But I think the idea was just to get rid of the old people and then hire like absolutely fresh people that would have no idea what happened previously. We did try to speak to the management, try to discuss this, so we don't have to, because of course none of us wanted to go on a strike. That was the final kind of decision. And then also knowing that when we gonna go on a strike, we would have this financial help from the union. I must say, at the beginning that was scary. On the first day I felt like, what if I'm the only one striking? What if everyone else went to work? But having the union representative there just telling us, oh, it's okay, don't worry. At the beginning I was scared to go to any picketing, so I didn't want my face to be seen because I felt like I might be the target, the company might punish me for this. But you know, the more of us were going, I felt more confident, like I want to fight back. I don't mind. I want my face to be there. I want them to see that it's not okay. I'm happy that things happened the way they did because it gave me a lesson that you can actually fight back, that, you know, there are unions that are able to help you with this. And if it wouldn't be for this, I would never know. So if anything like that would ever happen to me again, I know what to do.
Throughout it all, our members worked heroically. Our NHS was at the heart of saving lives. Our drivers, local government workers, food workers and energy workers endangered their own lives to keep the shelves filled, the lights on and the country running.
The last phone call I had with Dad, he rang me from his hospital bed and I could hear him taking this mask off, and the reason he called me was he wanted me to phone Heinz and let them know that he wasn't pretending to be ill. And that night he was put on a ventilator and put in a coma, and I never spoke to him again. Heinz and Unite really came together when Dad was ill and when he passed away. The union reached out and they contributed towards his funeral. I think he got the maximum allowance because he'd just been there for so long.
But the hard work is far from over. Exhausted and uncertain, we must now focus to shape the future economy. We are a union like no other, in a time like no other. Unite will always keep our members and communities safe, protected and decently paid.
Union voice, it was the only voice of the workers in the sector out there. Because otherwise we just hear the narrative from the employers basically pushing for reopening, and we were pushing for safety and to protect people's lives and their health and their families.
I think as an individual it's good to have your voice heard, but as a collective your voice is stronger. Absolutely. So the trade unions and Unite in particular have a huge care sector membership, and they have to be really vocal, and we will be.
Organisations like Unite need to keep up the fight like they have been doing, support campaigns for the public inquiry so that next time a pandemic happens it's not key workers like my dad that pay the price.
At the start of the lockdown, or very early on into the lockdown, it became it's very evident that the impact of COVID on Black, Asian, ethnic minority communities were quite significant and quite severe, particularly if people from that community contracted COVID, the likelihood of them dying was significantly increased in comparison to other people.
The work that the stewards and the safety reps done on the shop floor was absolutely incredible, and if it wasn't for them, I'm sure we'd be talking about even more numbers.
The businesses slowly start to reopen, first reopen for outdoor dinings, then for indoor. Businesses struggle to recruit employees. And they start to call pandemic unemployment as a reason of that shortage of workers. There is not a fault of pandemic unemployment payment. That is a fault of a bad working condition in hospitality way before the pandemic started. And now we want people to return for the same money with a risk of contracting potentially deadly virus. Do not be afraid of unions. Give us trust, because unions, essentially, it's workers. It's workers coming together and fighting for their rights.